Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
A mission to
Delivery
improve.
of Well, I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Chad Rodgers, and he is Chief Medical Officer for AFMC and a pediatrician. Dr. Rodgers, thanks for being here.
Thanks for having me.
So we're talking about childhood obesity today, and the stats for childhood obesity are pretty staggering.
Yeah, they are pretty alarming, and it's definitely been increasing, over the last several decades. And in Arkansas, we see it kind of, increasing even faster than some of our in the other states in the country. So we think about currently 1 in 5 children sort of have meet the requirements for the definition of obesity. Of course, that doesn't include a large number of kids that are at risk for being overweight or being overweight in the future.
And so that also puts children at risk for health problems that were once only seen in adults. Has that changed?
Yeah, in the 20 years I've been in practice, obviously we have always seen children who were struggling with their weight or kind of fell into that obesity category. But, in the last several years, just seeing the number of children who are beginning to develop things like type 2 diabetes, which we saw some in children, but not near what we saw in adults. It just continues to increase. Also, problems with high blood pressure and high cholesterol. And so, even my training 20 years ago didn't really include the management of how to manage type 2 diabetes or how to manage high cholesterol in children. And now that's becoming kind of part of our daily practice. And we see more and more children in our office that are requiring intervention, but also requiring medication, which, the past, we sort of kind of encouraged people to eat better, increase their nutrition. But now we're beginning to think about meds in order to treat obesity.
And so aside from treatment, prevention is key too. How can that be prevented? Like, what do you tell your patients?
Yeah, I think really the prevention side becomes part of every visit. We sort of, do a height and weight when the kids come in. We also, our computer system, or we can also calculate a body mass index, which sort of gives you an idea. So kids that are really tall or really short, their weight, may not be quite proportional to that percentage of their height or weight. So BMI kind of gives you a better idea of where that child fits in to the range of obesity for their height. So we began talking really early on, even in infancy, about the importance of nutrition and nutritious foods, what to select. And then every visit, we kind of follow that. We also kind of, talk about the importance of being, not necessarily athletic, but, just having some exercise or having some sort of routine in your daily life that you do to kind of help, not only burn some calories, but also improve your mental health. So trying to get kids in the habit of just, getting outdoors and play, or riding their bicycle, or getting out and playing basketball, those all become part of that prevention, part of medicine. But unfortunately, it just can't all occur in the exam room. It really has to occur where those kids are most of the day, and that's at school. And then, most of their waking hours at school, and then at home. And it really becomes a, not just the individual child's issue, but it becomes a family issue, and also becomes a community issue. So to try to just address it in the exam room doesn't help. I mean, it's something that, as far as prevention goes, and preventing the complications from obesity occurs outside of the exam room.
And how receptive are you seeing not only the kids, but the families that are there? Are you seeing it to where they acknowledge it and see that it's a problem, or is this to where they're in denial and don't want to make the change?
Yeah, it's a hard subject to talk about because, certainly, kids have a lot on their plate, and families have a lot on their plate already. I guess, as far as just how they feel about their health and what they're dealing with at home and with work and school. So, putting another layer on, we're a little concerned about your weight, you're increasing your weight, and it kind of feels very, defeating. Usually, when you have an overweight child, you also have other members of the family who are overweight. The lifestyle of the family kind of contributes to that. Maybe that the parents work a lot, so the kids don't have a lot of activity after school, or even getting out and do things. Maybe we eat a lot of fast food on the go. So there's so many things that families are already dealing with. To kind of put this into the conversation can sometimes feel defeating for them. So really, sometimes you kind of almost have to wait for the child or the family to come to you, that, they really have seen this as a problem and want to make it a priority. Culturally, I think too, we here in the South, a lot of our activities revolve around food. Sometimes the weather is not conducive to being active. We have kind of moved towards a lot of sugary and fast food beverages. Desserts are kind of part of every gathering. So, all those things kind of contribute to the children's overall health. So, it's kind of getting to people to be more aware, and that, that the intent is not to be negative or punitive, but try to be encouraging. And that's always kind of a hard one, especially for young women who sometimes so much self-esteem is based on their weight. And so it can be a very delicate conversation to have.
And are those conversations often started in a wellness visit, or are you seeing the kids before it comes to that point?
So of course, the wellness visit is a great time to talk about prevention and to talk about their current height and weight and what they're eating and, kind of what we can do. But unfortunately, a lot of visits I see come in because of complications. So a lot of orthopedic injuries, foot pain, ankle pain, back pain, maybe skin discoloration. That's a pretty common thing for people to kind of come in. So sometimes darker skinned individuals who are overweight develop, darkening around the neck. And so a lot of the visits start out kind of related to something else, but really kind of point back to the fact that we are struggling with our weight.
Interesting. And you touched on BMI data a little bit. And so that is still a component of this that providers still use.
Right. So we use it in every exam. And so every time, of course, most electronic healthcare records are going to go ahead and calculate that when the patient comes in. And it's something we do follow. Like I said, it's kind of something, it's a good screening tool, but it's not a real diagnostic tool. So you kind of have to look at every child individually. Like I said, the children that are extremely tall or maybe shorter than average, sometimes the BMI can kind of be a little bit more skewed, but it's a good way to kind of quickly screen and look for kids who may fall in that at-risk category or may already be in the obese or very severely obese categories. So we, have measured those in Arkansas for a while and been kind of monitoring the data. So I think it also gives us a good data point to kind of follow over time as we do interventions, not only in the exam room or in the schools, but also within our state. And we still get questions a lot about the BMI. Like I said, it's a good screening tool. So a lot of times the parents get a letter that their child's BMI is too low or too high. And it really has to be very individualized, but it's something that should be discussed with your healthcare provider.
And there's this weight loss drug craze for adults. We hear it all over in pop culture as well. Are you seeing that translate over into childhood obesity too, to where weight loss drugs for children is becoming something that's popular too?
Yeah, we're definitely seeing more and more kids who are coming to the office. They've read about it or they've seen it on TV. Also, the family has had the same exposure, but many of the family members are on these medications to help with weight loss. They have become very popular. They're very expensive and they're sometimes very hard to get. But beginning to get more and more questions about this because we are kind of like we have a problem. We often want a very quick fix and we often want a medication that addresses, the problem. But in the case of obesity, probably medication first is not a very good plan. But one that kind of comes at a course and when you've tried several other things. And, you have to remember kids are still growing and developing and they're active. So what a great time in their life, to kind of get them more active and get them on the path of eating well. And that becomes part of their life and their culture. So, we are beginning to have people ask more questions, but there's still a lot we don't know about the long-term effects of these medications on children. And so we have to be pretty cautious as we begin to kind of go down that path.
And tell us about the recent changes to AAP's policy for weight loss surgery and drugs for children.
Yeah, so because this is kind of something that we're seeing more and more commonly, the American Academy of Pediatrics actually included in their most recent recommendations on the treatment of obesity, and they began to include that for children who have done in families that have done interventions such as increasing activity and improving nutrition, they have worked on maybe some behavioral health or other things related to their obesity problem. that for kids that are extremely obese and are beginning to have complications from obesity or have complications, that maybe that conversation needs to begin to happen. And so for children and families that have sort of tried everything and then they sort of need that bridge or sort of that good start, maybe, weight loss drugs are something that we should consider more. Again, not knowing what the long-term safety is of these medications. And we do see in the adult population that once you're on, those people who stop often regain the weight. So is this something that you would have to be on lifelong? So there's other interventions that we need to look at. And of course, weight loss surgery for some older children is the only kind of good solution. And so, when is that safe and when is that? But that should really be done, with the pediatric healthcare providers at an institution that deals with it, that knows how to deal with the complications. These don't come without complications, but of course, also, being severely obese doesn't come without complications. So be kind of weighing that and making a good kind of judgment call on when this is going to be beneficial for a patient. And again, should really be kind of reserved for the most extreme cases and not kind of a common most people should be on.
And there's also mental health issues when addressing obesity as well. Is that something that you focus on a lot with patients that address this in your office?
Yeah, and I think that was the important part of those recommendations from the American Academy of Pediatrics is that we really do need to look at the mental health issues, especially when it comes to anxiety and depression. A lot of us really use food in order to kind of help us deal with, issues related to anxiety and depression. It becomes sort of a vicious cycle because then, as your weight increases, sometimes that can contribute to more anxiety and more depression. So we really need to consider that sort of mind-body component and as far as addressing obesity, make sure that families and children are getting the treatment that they needed for those mental health issues, that they're working with with a mental health provider who is experienced in this area. But then the treatments, and often for those kids who are really struggling, are very intensive behavioral health treatments, include not only the patient, but the family. And so it's a very, intensive intervention that not all payers are kind of covering, certainly mental health related to medications for depression and anxiety, but for the sort of intensive interventions that really need to change behavior related to, eating as a source to kind of help console yourself or help deal with your anxiety and depression, really are very time intensive and costly, but have good long-term benefits.
Well, Dr. Rodgers, thank you for talking about this today and reviewing the recent changes with AAP and how important it is to not only see your pediatrician, but talking that out with your provider is so important, not only as adults, but as children as well.
Definitely.
Well, that's it for this episode of AFMC TV. Thanks for watching and have a great day.